Can you get pregnant without ovulating? The short answer is not directly. But there's an important reason pregnancy can still happen when you think you weren't ovulating. First, let's understand ovulation. Ovulation is the process where an ovary releases a mature egg, although the timing can vary considerably between women and even from cycle to cycle. For pregnancy to begin naturally, a sperm must fertilize an egg. Without an egg being released, there is normally nothing for sperm to fertilize, so technically, pregnancy. But here's where things get confusing. You may believe you weren't ovulating when you had sex, when in reality, ovulation may have happened earlier or later than you expected. This is because sperm can survive inside the female reproductive tract for several favorable conditions, so a few days before ovulation, sperm may still be present when the egg is eventually released. This is why the fertile window isn't limited to the exact day of ovulation. The days leading up to ovulation can also be fertile because sperm may survive long enough to meet the egg. Yes. Many women don't feel ovulation happening. Some experience mild pelvic pain or changes in cervical mucus, while others notice absolutely nothing. Timing can be even harder to predict when menstrual cycles are irregular. Illness, changes in routine, hormonal conditions, breastfeeding, and other factors can affect when ovulation occurs. If ovulation genuinely did not occur during that cycle, natural pregnancy would not occur because no egg was released for fertilization. But there's an important distinction. Not having obvious signs of ovulation does not mean ovulation didn't happen. When ovulation doesn't occur, this is called anovulation. It can happen occasionally, or it can happen repeatedly because of hormonal or other health factors. Repeated anovulation can make it difficult to become pregnant and may cause irregular or absent periods. So when someone says, "I got pregnant even though I wasn't ovulating," the explanation is often that ovulation occurred at a different time than expected. Pregnancy itself requires an egg, sperm, fertilization, and successful implantation. This is also why pregnancy can sometimes happen after sex during a period. If ovulation occurs soon afterward and sperm are still viable, having a period does not automatically mean pregnancy is impossible from sex at that time. This is why relying only on safe days can be unreliable if you're trying to prevent pregnancy. Ovulation isn't always predictable, and cycle length can change. If avoiding pregnancy is important to you, use a reliable form of contraception rather than depending only on calendar calculations. Depending on your goal, ovulation can be tracked, using methods such as ovulation predictor kits, changes in cervical mucus, basal body. Each method has limitations, so talk with a healthcare professional if you need a more accurate assessment. If you're trying to become pregnant, understanding ovulation can help you identify the fertile window. Having sex during the days leading up to ovulation and around ovulation generally gives sperm an opportunity to be present when an egg is released. And if you're trying to avoid pregnancy, remember this: you cannot always predict ovulation perfectly. A reliable contraceptive method provides much better protection than guessing which days are fertile. So, can you get pregnant without ovulating? No, not from natural conception if ovulation truly never occurs during that cycle. But you can become pregnant after sex. That happened when you thought you weren't ovulating, because ovulation may have occurred earlier or later than expected. Your menstrual calendar can give you an estimate. But your body doesn't always follow the calendar. If you learned something new today, share this video with someone who needs to hear it. And subscribe to Nurse J for more simple, science-based health and pregnancy education. Subscribe for daily science shorts.